Hello, everyone. I'm Benny DeCecca, the Chief Executive Officer of Validation Institute. Today, we are talking about musculoskeletal solutions with Vori Health. We'll explore how employers can put an end to needless surgical expenses, support their workforce in accessing optimal MSK care through expert medical teams, all the while achieving substantial cost reductions. So let me get started by introducing the CEO and co-founder of Vori Health, Dr. Ryan Grant. Hello, Ryan, and thank you for being here today.
Thanks, Benny. Thanks for having me.
So I know I kicked off with a fraction of what Vori does, but can you tell me more about the problem you are solving and for whom?
No, it's a great question. My background, neurosurgeon by training, fellowship trained in spine surgery, spent some time getting educated at University of Pennsylvania, then was up at Yale University, and then more recently at Geisinger Medical Center. I decided to shut my practice down during the pandemic. To be blunt, we operate way too much as surgeons. Surgery has its place, but it's heavily overutilized. Depending on who you want to read, including Harvard Business Review, the average health system does over 50%, 50, unnecessary or inappropriate spine surgery. They're not bad people. We could spend a semester of how we got here as a country since World War II, but health systems have built business models around facility fees, which is how they mostly get paid with for surgical procedures. Those are the same institutions that also train the new guard, the new clinicians. And so really now we're at an education crisis where nobody thinks we're doing anything wrong, but we sort of have lost our way. Given all of that, wanted to start over and build a new care model from scratch that puts patients first, that follows the evidence, that doesn't do unnecessary surgery or unnecessary imaging or not unnecessary injections. These are people's loved ones. And if you're going to take somebody to the operating room to literally cut them open with a scalpel, it better be for really evidence-based best practice procedures. And so that's what was the impetus to shut my practice down to do this.
Wow. And what sets Vori apart from other MSK solutions?
That's a great question. There are several other players in the space, particularly on the virtual side. They tend to be heavily physical therapy only. I would argue that physical therapy is necessary but insufficient. And so we wanted to tackle this from a medical practice standpoint. What does that mean? We are doctor-led, physician-led. We employ non-operative physicians trained in either sports medicine or physical medicine rehabilitation. That would be the corollary of what the cardiologist is to the heart surgeon, who actually work together with doctors of physical therapy and health coaches and care navigators to actually have a true integrated care team who then practices evidence-based care with the patient's goals at mind. Other thing that we also want to tackle is a lot of musculoskeletal or orthopedic surgery, which includes back, neck, hip, knee, shoulder. Many of the procedures are quality of life operations. So making sure we have conversations with patients of is surgery a necessity or is it an option? I'll be the first to admit I was taught to talk to people in absolute surgery is you should have surgery versus a lot of these surgeries really belong, in my opinion, in the facelift category. What do I mean by that? Nobody needs a facelift. How bad do your wrinkles bother you as you age is a very personal decision. If they really bother you, you can escalate to injections. And if they still bother you, you can escalate to evidence-based best practice facelift procedures with a plastic surgeon. Or if they don't bother you, you can do nothing about it. And so that's a very specific. If you only have pain, not to minimize how uncomfortable you might be, first, have you exhausted a non-operative program? Then, if you do meet criteria for potential surgery, is it a necessity or is it just an option? And if it's an option, does the patient understand that? Most people, if you audit them on the surgical arm, they don't know that surgery was an option. They think they have to have it because they were told to.
And how do you reduce overall costs for employers and plans?
That's a great question. Reducing unnecessary surgery is part of it. Don't get me wrong, I'm not anti-surgery. Surgery has its place. We refer about 3% of our patients onto the surgical arm. It's just reducing the unnecessary or inappropriate surgical expense. Also making sure that someone has the right diagnosis. So for example, somebody comes in with back pain. which is the most common condition, also one of the top Google searches. Low back pain is also the #1 cause of years lived with disability across the entire planet. And so it's very prevalent, very prominent. Over 50% of people have back pain at any given moment usually. And over 85 to 90% of people will experience back pain during their lifetime at some point. I'm sure most people listening have had their back hurt at some point. And so if someone comes in, first question is, are we sure they don't have cancer? This is part of our clinical thing. Make sure they don't have cancer, fracture. We worried about something dangerous. That's very rare, to make sure they get into the right pathway. Next, it gets into what's the most likely driver of their pain. Back pain can be multifactorial, and some people up to 25% of back pain can come actually from the pelvis, where the spine inserts, and it's not actually from the back itself, but it feels like it. Up to 40% of back pain can actually come from the hip. So are we working at first? Are we going to work on the right body part? Back pain doesn't just mean spine. Next goal is, assuming they don't have anything dangerous, what is the patient trying to achieve beyond pain? Nancy wants to walk her kid to school, but she feels she can't, her back hurts. That's her favorite pastime. Fatima wants to keep running marathons, but her knee hurts. Like, what is the person trying to get to? Mrs. Johnson just wants to walk around Target and be able to shop with minimal pain, unassisted. Like, those are all very different goals. The person who wants to run a marathon versus walk around Target, those are very different care plans in terms of how aggressive they are. So are we meeting the patient's goals? Most people will get better with the right diagnosis, the right care plan that's around their goals. And then given that we're a medical practice, we can write non-opiate pain pills. We don't push pills, but some people will benefit from having a prescription in lieu of going to the ER to get through a care plan. We will wean them off those medications before they finish. Some people do meet criteria for imaging, and we don't push imaging, but if it makes sense, we can. Our competitors can't order imaging or write prescriptions because they're not medical practices, so that's another differentiator. And then for those who do meet criteria for surgery, meaning they have exhausted and completed the whole care plan, get people ready and optimized for surgery to decrease length of stay, infection, surgical complications, and then get them over to surgical partners. So really an end-to-end is how we think about it.
You're doing such amazing things. So can I ask, why did you pursue validation?
It's a great question. Your new company, you got to start to have proof in the pudding of, does it work? What are the results? Third parties looking at your data to say, yes, we agree, is very powerful. It helps build trust. It helps build on that story of, just don't take my word for it. Just what are we actually showing, and what are our outcomes, etc.
And I encourage everyone to go to validationinstitute.com and download the Vori Health Report and see for themselves. Now, before I let you go, as you know, it's a rigorous process to get validated. We know many companies make ridiculous, unsubstantiated claims. So what advice would you have for a company considering validation?
That's a great question. What are you trying to get to? When we went through this is beyond just a marketing play. We want to make sure the way we derive value is, first is the value to the patient or the member, another human being. So are they reaching their goals? Are we decreasing depression, anxiety, pain? Are we actually getting the members to where they want to be? Next is value to your partner. Most musculoskeletal orthopedic conditions are paid for by a health plan. This is not a sector that the public prefers, that wants to pay cash. So they sort of expect their health plan or their employer to cover most of the services. You can argue if that's right or wrong. That is the public sentiment for musculoskeletal orthopedics. So we're driving value to our B2B partners, whether a health plan, an employer, or an at-risk primary care provider. And then last, are you driving value to the bottom line? So are you driving quality? Are you getting members to where they want to go? And then are you saving your clients money as well?
Well, great stuff. So as we wrap up our discussion, I want to extend my gratitude to Ryan for your expertise and insight that have enriched our understanding of MSK solutions in the path towards enhanced employee well-being. I can't wait to hear more from you about the continued success and innovation from Vori Health. So thank you once again for being here, Ryan.
Thank you so much for having us.
And I hope you and everyone out there all have a great day.